Throughout the exercises that I'm going to talk about with the eye movement and with the laser and the little nose alphabets coming up, um, it's just really nice to reinforce stability any way that we can, so that tongue to the roof of the mouth is really nice to incorporate with these other exercises I'm about to demonstrate as well. I am talking through these exercises, so I am not going to be able to do that, but just a note that that's something when we talk about adding layers for these patients of the layers of things that can be beneficial and stabilizing. The tongue to the roof of the mouth position with just a slight engagement can actually help stabilize to give access to these other exercises. For people who have upper cervical instability that's more moderate to severe cases, it might seem like there aren't any exercises that are well tolerated, and that might be true, but I wanted to offer some insight into other options, things that we don't necessarily think about as standard exercises, but are entryways potentially to access some upper cervical stability, those small, deep cervical stabilizing muscles, or adjunct muscles as well. And what I'm going to focus on in this clip together video is really stuff around this head and neck space. But I want to say also that there is a world of things out there from outside of the upper cervical spine that can actually help and influence that area. So Susan Chalela puts together some information and works with her patients really on this idea of core alignment and stability. So things down in the lumbar spine and pelvis have to be lined up and activating correctly as a base for the rest of our spine and head to sit on. So for just to mention that I'm going to focus up here, but for some individuals that feel like they have no access to working on any part of the upper cervical spine, they might be able to tolerate things that work on pelvic floor control, things that work on pelvic stability, lumbosacral stability, things like that might actually help and influence the upper cervical spine as well. So the ones that I'm going to focus on in this video are again in this area, and we're going to go over just tongue to the roof of the mouth that activates the deep stabilizing muscles. We're going to go over just some eye movement and exercises and placement strategies. And then we're going to go over redefining how to use the head laser for individuals that again have more moderate to severe cases. There's different ways that we can use it to hopefully in ways that we can less likely irritate the cervical spine and still get some benefit out of using it. The first one that I'm going to go over is tongue to the roof of the mouth. And this is actually where the tongue should be most of the time, is resting on the roof of the mouth. And some individuals have some restrictions, lingual restrictions or tongue tie that can make it difficult, or for a number of other reasons like a high palate and things like that. But we do know that bringing the tongue to the roof of the mouth and gently engaging the muscles there can actually reinforce those deep cervical stabilizing muscles. So rather than doing a chin tuck exercise to try to engage those, just bringing the tongue to the roof of the mouth might start to activate those muscles and can feel more comfortable for individuals that are more reactive in that upper cervical area when directly firing those muscles. So with the tongue to the roof of the mouth, it's really just like it says, tongue to the roof of the mouth. So we bring the tongue up to the roof of the mouth, with the tongue tip sitting just behind the front teeth, and we form a little bit of a suction. So if I were to let the suction go, you get that clicking noise, but we're not doing the full suction. We're just engaging enough to feel the pressure of the tongue against the roof of the mouth. So we're not full suctioning. We're not trying to stretch or pull. We're just bringing the tongue to the roof of the mouth. That is it for this exercise. So again, simple stability work for individuals who feel like I react to everything. This is really typically for most individuals gentle, and is something that we can start as an entry point to start activating those deep stabilizers, and then maybe work our way into what we think of are, other type of stabilizing exercises like moving the eyes, we'll go over in a moment, and then even using a cervical laser as well. But bring the tongue to the roof of the mouth. Three to 5 seconds, and repeating that until we feel like the muscles are fatiguing or they've had enough, right? So it could be 1 or 3 or 5, it doesn't matter where you start. It's really just about engaging and having a starting point so that we can progress with that. Okay, so really simple exercise. It does engage the stabilizers, highly recommended. And I would say even for individuals that we suspect are moderate to severe instability of the upper cervical spine, that perhaps we start here to see what happens if we ask them more consistently to engage those muscles before we jump into what we think the bigger exercises are. Can they do that more consistently without flaring things up as well? So tongue to the roof of mouth, great starting point. The next exercise I'm going to go over that can actually help some individuals with starting to engage some of the upper cervical muscles in a direct but somewhat indirect way is starting to move the eye muscles. And with all of these exercises, it doesn't sound like we're doing a lot by just moving the eyes, but the eyes actually do really integrate with the movement of the first cervical vertebrae, C1. So keep that in mind. We don't want to stress or strain with this exercise. What we actually want to do is hopefully find a place of almost relaxation and ease in some individuals, or improvement in symptoms afterwards. So we do use something like this when, if you've seen our neural mobility videos that we have out there of eye movement to work on nerve mobility, and this is a little bit different. So we actually do want to be in good posture, really for all of these. So we can certainly support with a high back chair. We don't need to overwork the posture. So fully support yourself, string through the center of the head, trying to lift upright, good posture, and then some gentle eye movement. Now, if we've worked with a therapist or we just happen to perhaps know what position C1 is in, we might be able to use that to figure out which way to move the eyes. So I think of it kind of as flying a plane. So if our C1 is, say, rotated down and to the right, we want to guide it up, or down and to the left, we want to guide it up and to the right with our eyes. So that's the way the eyes are going, to try to pull that C1 back up into a neutral position. So it's the opposite of where it's sitting. So that's if we know where it is, or if we can feel where it is, or let's just say we're one of those people that it always goes out, down and to the right, which is mine. So that's how I'll demonstrate. So if that's the case for me, and you don't have to do this sitting up, we can certainly do this lying down, fully supported, neck roll if we need it. We're going to get movement from the muscles around C1, even lying down supine. We don't have to do all of this challenge with it. And I do recommend just gently supporting the wings of C1. So that's underneath, just about underneath the ears here. Sometimes we can feel them just poking out a little bit. Under the base of the skull, underneath the ear, and just resting your fingers on there. And I like to feel this for just validation of things are moving around C1 when we move our eyes. And this is not to push, this is not to relocate at all. This is just to feel what's happening. And sometimes we can actually feel C1 moving under our fingers, hopefully in a better position, right? So if my vertebrae is rotated down and to the right, I am going to, for this exercise, I'll keep my eyes open so that you can see. But what we're going to do, whether it's lying down or sitting up, is if it's down and to the right, that's where my C1 is, I'm going to move my eyes up and to the left. Now, my head stays neutral. That's why it's a little bit easier to start this when you're lying down so that we don't turn the head with it. And that's about all that my eyes and my C1 wants together. About 3 to 5 seconds. And then we can come back down to neutral, and then we can come back up, and we can repeat that anywhere from 1 time to 3 to 5 times if it feels good. So again, this is kind of like a muscle energy technique for the C1 vertebrae by using the eyes. I keep my eyes open in this video. I usually tell people close them. When you have individuals that have upper cervical instability that's moderate to severe, we usually have more neurological irritation, and that includes visual input. So we don't need to overstimulate the system. So in other words, if I were actually doing this, I would keep my eyes closed, and behind my eyelids, I'm lifting up and to the left. We don't need extra neurological stimulation, and then we can come back down to neutral. Okay, so that's a muscle energy technique if we know where our C1 is positioned and where we need to get it back into place. The other eye component is, where does it feel good to move your eyes? right? We never want to pull or crank on C1, but just starting to move, you can get some of that neuromobility work, and you can activate the small little stabilizing muscles that's around that upper cervical spine and the suboccipital space in C1. So if you don't know where your C1 is located, or you don't feel confident with that, that is still okay. You can still, and again, I'm going to keep my eyes open so that you can see, you can still move the eyes around, keeping the head neutral. It's really about the intention of the exercise. And where does it feel good to leave the eyes? And then again, we can do small repetitions, slow repetitions. And we don't want to try to stretch the eyes, right? That'll be stretching of our some of our cranial nerves. And we don't want to stretch yet, especially with a highly reactive system. So we just want to gently move within a small range. No need to go all the way over to one side or the other. Small range motions just to start to activate those muscles around the upper cervical spine. So we can do it with a little bit more precision and knowing where we're supposed to get to, working with a therapist, hopefully, that can tell us which way we're supposed to be moving that C1. Or we can just do very gentle eye movements, very gentle in a small, narrow space, just to start to activate those muscles on top. Again, start very low, very slow, and then we might be able to progress into some other exercises. Okay, the last one and next one in this series of kind of where I foundationally start with people outside of, the rest of the spine and pelvis and all of that, but in this area would be the head proprioception laser. So yes, you can find them online, these little spelunking type helmets. I have mine right here, which I'm going to actually demonstrate just some examples of what I'm going to talk about. But yes, you can always get one of those cat lasers and put it on a ball cap. As long as we can set you up in a neutral position with a wall and with that ball cap, then it's okay. We have a number of different ways that we can use this strategy, right? But we tend to think of these head lasers and they come with these giant mazes. We have one rolled up in the corner over there, have never used it in the office. And it's just not necessarily something that we start with, especially with our population that we tend to see, those more moderate to severe cases. Those cases don't really like to do a whole lot of, especially head rotation and these micro adjustment movements. We're not there yet, right? We really have to learn to activate and just keep the head in place on the neck. So what we do is a lot of neutral positioning activities. In other words, we keep the head still and we challenge the muscles. So I want to take a moment to demonstrate what that looks like with the head laser on. So we use other parts of the body, arms and legs and things like that. And then I'll show you after the head laser just a little tiny exercise that one of my buddy uses for her patients if we don't have a head laser. But again, micro movements is where we're going to start, but we're going to keep the head neutral for these next few laser exercises. Okay, hopefully somebody has been able to help set you up. We're not going to go through the whole setup right now, but we're about 3 feet from the wall. I have a nice bullseye. You can print out a bullseye at home, or you can use a sticky note. Totally fine, as long as you have something to aim for. But what we want to make sure, especially when we're starting, we do not need to challenge the rest of the body, but to have something where we can lean back for spinal support. We really just want to work this area in here. So I'm not concerned over sitting on a ball and trying to balance. We want everything fully supported, okay? And we even have had some people that we start lying on the ground, just aiming at a point on the ceiling. So this isn't even still as far back as we can take it in the amount of hopefully easy versus difficult strategies that we have. But most people can start here because, and again, we want to make sure that everything is lined up. The laser should be horizontal and we have our bullseye lined up there. And I do have some upper cervical instability and I have not practiced this for a while, so it should be good to show an example of what this looks like. So honestly, when we do make sure that if we can have somebody fully supported, my feet aren't fully supported right now, but that's okay. I just wanted to point that out. And then we just work on breathing. That's step one. Can somebody hold, hopefully without too much bouncing, in the center of their bullseye or sticky note, just breathing. That's not too bad. And then the next step, because we want stability. So we don't want to challenge left versus right, one side pulling on the spine, not the other. We're going to use arms together. Okay, so again, my goal is to keep my head where it is, and the challenge actually comes from force being applied to the spine from other muscles. So I'm going to clasp my hands together, and I'm going to lift to shoulder height and then try to control it on the way down and keep my little laser in the middle of my bullseye. And that was pretty good. So I usually tell people no more than 60 seconds if we can even make it there, right? We don't want to over challenge the system. These muscles can get really tired really quick. So just about 60 seconds and doing that consistently. So 3 to 5 times a week. If we can do it every day, that's great. But consistency. And then how does it feel? Can we progress from there? So after we go through our double arms lifting so that we activate on both sides of the spine, then we would progress to just lifting one arm at a time. And this can actually give us some insight over what side, right versus left, that we might need to focus a little bit more on kind of the whole complex, that it's shoulder neck complex if we're having issues there. But let's try just lifting. And again, we don't have to go too far. We can lift to shoulder height and back down on each side. Okay, and I'll try my right. Not too bad. And you really want to stay with the level of ease for quite some time. So if you're starting to skip around and we can't hold it in the middle, then you're going to stay with probably the previous exercise for a little while before it becomes very easy, and then you can move on to whichever one you're skipping around with. And then just to kind of show the progression, because we haven't moved the head yet, but there's still so much that we can do. So we can move both arms alternating at the same time. Okay, obviously a little bit harder for me. We can go in different planes of motion. We can lift out to the side, both arms again. We can do one at a time. Whoa, this is not great for me. But so much that we can do. We can even sit and march. Lift a knee and back down. Lift another knee. We can incorporate knee and arm. Other side. So a lot that we can do, not moving the head at all. And this really, we need to be able to control the head in neutral with body motions before we give people exercises where we're trying to follow patterns or lines. We need to trust the head can stabilize without movement first. So I highly suggest that everybody starts here to see kind of testing as well, where they might have issues, one arm versus the other, legs lifting up, core activation. So there's a lot that we can do in this head neutral position before we ever get to what we think is the start of head proprioception exercises. So just a few ideas of things to start with first. Just to go over one other exercise that does actually involve a little bit of head movement, but we're going to keep it microscopic. There is an option to do nose alphabets, and this is my buddy Susan Shalala. She does a lot of upper cervical instability work. This is something that she does teach to her patients as well. So if we really can't get a head laser, or it's inaccessible, or it's broken, or whatever it might be, and we really want to get some of that training in, we really have to remember, again, tiny movements is what we're working on with those stabilizing muscles. So if you picture a pencil on the tip of your nose, but the width of your paper is only the width of your nostrils. My paper is just the size of my nose, that is it. And I want to draw the alphabet on that paper. You can't draw off of the paper. It's a very tiny piece of paper. So I'm going to demonstrate what my alphabets look like. And again, I'm sitting up. You can absolutely do this lying down with your head fully supported. We're still going to get muscle activation. And yes, you still get muscle activation of those deep cervical stabilizers, even with this teeny tiny movement. That's actually the ones that we're looking for to help with proprioception and neuromuscular control. So these little tiny alphabet exercises, I've got my pencil on my nose, my teeny tiny little paper that's only this wide, and I'm going to draw the alphabet. That is the size of my alphabet. That's it. So just a few ideas of some things that we've seen work a little bit better for some of our patients that are more reactive and have upper cervical pathology. A place to start for individuals. I know a lot of times we think of these isometrics, and yes, at some point we would like people to be able to get into the co-activation of the large muscles with the small muscles, but we have to be able to control that neuromuscular control first and stabilize the joint with movement before we really demand larger things out of it. So a few ideas to consider trying with your, hopefully, rehab professional if you're working with one, or if we can maybe try some just in a safe space. But again, this does not replace medical advice. This is just an idea, especially for providers out there watching this, of different things that we can try that maybe we haven't thought of before because it seems too easy, right? Or the basics. And that's actually what we need for these particular individuals.